We don't know a lot about the federal legislation yet, but what I do know is that you have to be ineligible for regular unemployment insurance benefits. So we're saying you can go ahead and apply.
You have to be denied,
and then be denied so that we can move into this other program. Our system is really designed for this. So what we're having people do is to put in their, you can manually enter an employer, so to put in your own name and your own mailing address. But we need to get that. I don't think people.
Yeah, have you got any more progress in programs?
So actually, we just got a sheet.
A sheet? Good.
As we were coming over here.
Like 10 minutes ago.
And then we have our staff on a conference call with the federal government.
I noticed a lot of
right now.
a lot of people logging into the Facebook Live thing the other day. A high percentage of them were asking about $600.
Yeah, I would like to get that in writing.
Because we still don't have guidance on that piece. We only have guidance on PUA.
No, we
It's
don't have
pretty-
any guidance.
It's pretty much,
Right.
it's assumed though, just based on what I've read, again, I read the federal legislation, that it's assumed that it was intended that everybody get that on top of what their benefits are. Yeah.
That's pretty clear.
But
The piece
mechanically,
that's,
how you get it,
the piece that was confusing is which of our programs. So we have shared work, we have regular live, and we're adding PUA. What is that acronym? PUA is Pandemic Unemployment Assistance.
Okay, I want to make sure that that comes across.
and that's kind of a fast track way, because you don't do as much verification for that, or?
No.
It's a fast track.
Nothing fast.
It's so fun.
Because you'll have to go through the regular unemployment insurance process, and then go through this process. So, it'll be, we're going to try to get it streamlined and as simple as possible.
It's really hard for systems to be geared up and ready to handle
This one.
pandemic level stuff. I mean, whether you're talking about public health or this, you can't have those systems stood up and as ready all the time. I mean, you just can't.
Well, especially when the record low unemployment.
Right.
Yes.
Right.
And we were funded for that. The system that we have in place that most of the program operates off of was built, we believe, in 1977.
Really.
The year was fun.
And
And it's not the kind of thing you can redesign on the fly.
and we were actually doing almost modernizing our system before all this happened.
Okay, welcome back, everybody. Today we're here to address the latest developments on COVID-19 in Kansas. Today brought news of 3 new deaths in Kansas attributed to COVID-19, bringing the total to 13. Currently, KDHE is also reporting 552 positive cases throughout Kansas, and 44 counties that have reported at least 1 case. I'd also like to give an update on the serious challenges for unemployed workers in our state. So many Kansans have lost their job due to the fallout from COVID-19. My recent executive order called for easing the process for those who've lost their jobs. But the tremendous surge in claims over the past week has overwhelmed the Department of Labor's online system of applying for and receiving benefits. I promised to be as transparent as possible and to provide you with answers to the challenges we face as this crisis continues to unfold. Today, I'm here to talk to you about one such challenge. I mentioned the other day that the Department of Labor has been overwhelmed with phone calls to their call centers from those seeking to file for unemployment. On Monday alone, they received 877,000 calls. I know it's been extremely difficult to get through on the phone, and for that, I'm sorry. But here's what we're doing to help fix the problem. First, we've brought on Amazon Web Services, which will help expand capacity for the call centers. It will also allow us to begin sorting out types of calls so that those who need to talk to somebody who can help them fill out their forms can do so. If someone just needs to reset their account password, they can be rerouted elsewhere. This will help to organize these calls and will allow us to bring in non-labor employees to answer some of these important but non-technical calls. We're also repurposing an entire division within labor to help answer phones. We have hired back employees who have left the agency or recently retired, and we are in the process of temporarily assigning dozens of other state employees from other agencies to assist. It is not unusual for state employees to be reassigned to other agencies during emergencies. However, we think that once this is all said and done, this will be the largest temporary employee reassignment in recent history, if not in all of history. You know, when I said all hands on deck, I meant it, and state employees are responding. My team also is scrambling to put in place long overdue equipment and systems upgrades to handle the high volume of requests. We didn't get into this situation overnight. Years of neglect and underfunding have taken their toll on this agency and these critical systems. And unfortunately, we're not going to get back overnight either. Thankfully, we have dedicated and talented employees in place to help and skilled leadership at the top with the commitment and the passion for service. And we will hear from Secretary Garcia shortly. To every Kansan who has hit a wall in a request for claims or who has had other issues getting through, please know we're doing everything we can to improve the services. The best way to apply for benefits is still to go online at getkansasbenefits.gov. If you do call into the unemployment hotline, don't hang up. It'll just put you to the back of the line. You won't get through any faster. I know it's frustrating, but with call volumes this high, it'll not improve your chances of getting through if you hang up and call back multiple times. Unemployed Kansans need and deserve help right now. And while it's true that we aren't going to get out of this situation overnight, we are moving mountains every day to make things better. We have one goal: fix the problems quickly and make sure that all out-of-work Kansans receive their unemployment benefits in a timely manner. Finally, Labor Secretary Garcia has set up a team whose job it is to respond to questions and provide updates for the public. We also know that the financial strain of COVID-19 pandemic has hurt many more Kansans and employers statewide. Today, the Department of Revenue, through Notice 20-02, is waiving applicable penalty and interest on first quarter 2020 estimated tax payments made after April 15th, but on or before July 15th, 2020. This applies to individual income tax, corporate income tax, and privilege tax. It is not an executive order. Secretary Burkhart at the Department of Revenue is issuing this under his power as secretary. Kansans, their families, and many businesses have been hit hard by this epidemic. We will pursue every possible strategy to help Kansans who need relief during this unprecedented crisis. I'd also like to follow up on Secretary Norman's mention yesterday of Unicast, which gathers GPS data from smartphones to create an online social distancing scoreboard for states and other areas. It helps us to follow where people are not staying home and saving lives. That information will allow us to get our message out even more effectively. To be clear, the state doesn't have any special access to this information, and we don't have any contracts with this company. Instead, the information is publicly available to anyone who visits their site, and that is unicast.com, UNACAST.com. It is collected from information that cell phone users have provided. It is a simple, visual tool that helps inform the public on social distancing so that we can continue to flatten the curve and ultimately save lives. The scoreboard also shows there's always room for improvement when it comes to reining in the spread of COVID-19. Please do everything you can to follow the stay-at-home orders to ensure your safety and the safety of everyone else. As part of my administration's ongoing efforts to flatten the curve, state government buildings will continue to remain closed to the public and to most employees until at least April 19th. The state will begin to resume more normal operations this coming Monday, although most employees will be working remotely. My department and the Department of Administration have spent the past few weeks assessing the equipment needs of each agency to enable as many employees as possible to work remotely and still maintain social distancing. Our public employees perform critical functions here in Kansas. That work must continue, especially in the time of crisis. While state government work may look a little bit different, we'll continue to deliver the vital services Kansans depend upon. The needs of our constituents matter most. We can still serve Kansans as we adjust to our new normal. As details about specific agencies, services, and buildings are worked out, we will let you know. The bottom line is this: we all can do something to flatten the curve. First and foremost, stay at home, stay safe, and stay healthy. Thank you, and with that, I'll hand it over to Secretary Delia Garcia from the Department of Labor for a brief update.
Thank you, Governor. And good afternoon. I am glad I'm here with you today to have a straightforward conversation on what is happening with our economic situation in Kansas currently. As I keep sharing on our daily updates on our social media and our website at www.getkansasbenefits.gov, this is going to be a partnership at every level, including government, Kansas workers, Kansas employers, and the media, and everyone in between. I'll share some things here in the next few seconds, what we've been doing to respond to this health and economic crisis. We just got the federal unemployment numbers this morning, and across the nation in the most recent 2 weeks span, we have roughly 10 million people filing for unemployment benefits at the national level. And that includes Kansas's, where in the last 2 weeks, Kansas, we have currently 79,353 claims. As the governor mentioned, on Monday alone, we have received over 877,000 attempted calls to our call center, as well as matching numbers of emails. Departments of labor across the country are dealing with the same situation. We here at the Kansas Department of Labor are working around the clock every day to provide the best possible services given the circumstances. And so far, I want you to know that I have doubled my staff in just 1 week previously, when this all started. I have reassigned staff, bringing more staff back and including from other agencies, and thank you to the governor for setting some of that up. We addressed capacity issues for the website. So there was some good news. In the last 48 hours, we enhanced our automated system. The username, people were having issues, and a lot of phone calls we were receiving regarding the username, password, and PIN resets for customers, as well as the email resets. We have fixed those. And so due to the high volume of all the phone calls and emails, we are not able to go back and call each of those people. So we're asking people to please go to our website at www.getkansasbenefits.gov and go ahead and reset the prompts. There's two options. If it was the username, you can click on that and follow the prompts. If it was a password and PIN, you click on that and follow the prompts. If you still continue to have a problem, then there is an email, and you would need to send a fresh new email so that we can help follow up with you. We are working every day, long hours, in ways to expand our capacity to better address this economic and health crisis. We provide updates, as you know, every day on our social media and our website. So we want people to please stay tuned. We're doing that every morning at 9:30, and then we have our virtual town halls every Wednesday at 3 on Thursday. We have whatever questions we do not answer there, we try and answer the next day. I know I sound like a broken record when I say please use www.getkansasbenefits.gov. But that is, information is available 24/7 there. A lot of times a lot of people's questions can be addressed by the new frequently asked questions we are updating every day. The phone number that is supposed to be reserved for people who do not have the internet, they're non-English speakers, military, people who have moved to Kansas in the last 18 months. And that phone number for those that is reserved for them is 1-800-292-6333. In an effort to help Kansans who have lost their employment due to COVID-19, and as a part of Governor Kelly's Executive Order of 2017, we have waived the waiting week requirement for COVID-19 related claims that have been filed and processed. We are aware of the issues related to the payment of the waiting week. Implementing this waiver is rapidly changing environment, has proved challenging and due to the limitations within our current technology. The newest piece of information I'd like to share with you is at this time, approximately 60% of claimants who have a waiting week that qualify payment have received their payment. We are working diligently to address the issues preventing payment for the remaining qualified claimants. I do want to say the most important piece of information there is that claimants should know that you will receive the funds. I know that's been a recurring question, and people are anxious and scared, rightfully so. Will I receive their funds? Yes, you will. And just ask your continued patience and to please hold the calls. I know it's hard to not keep calling, but we want you to know you will receive those funds. Also, we are waiting federal guidance on the implementations of the CARES Act and the Pandemic Employment Assistance, also known as PUA. As soon as we know, we will share information and update our system accordingly, and we will put that on our social media and website. So please, I want to thank you for holding those calls, as those calls are also adding into the queue. With our partnership with you all at Kansas at Home, we will get through this together. With our consolidated teamwork, you at home, us at the Kansas Department of Labor, and everyone in between. We're working to address the challenges we inherited with our aging UI system. And in the meantime, my team will continue the efforts to connect with impacted workers and businesses during this critical time. These are challenging times for everyone. I know, I understand, and I feel that. We will get through this together, I know. From day one, I have made it a point to stay engaged with our Kansas employers and workers on a regular basis, and continuing to do that now. I care about our Kansas workers and my staff doing everything we can, and many of our own families have been impacted by this health and economic crisis. They are working around the clock because they know what it's like to struggle to put food on our tables. I want to especially thank our call center staff and all the other groups supporting us who are going above and beyond to support you at home. Thank you for everyone in your partnership, and I will stand for questions.
Excuse me, Secretary, that 70,000 number you just gave, what is that? Is that the 55,000 number updated midweek, first time claim, or is that first time they continue the claims?
It's an initial claim.
Initial claim?
So it was initial claims for the last 2 weeks combined together. So the 22,000 we had last week and then the 55,000.
23,000.
23,925.
Yes. And then the additional 55.
So those are together combined.
And I missed the number you gave, Governor, when you talked about the number of staff you're redeploying.
I said several dozen from other agencies, plus we are bringing back a number of retired employees or employees who left Department of Labor. So they're all coming back. And Secretary, do you have any idea how many that will add up to?
So we have about 12, we're like about over 15 now, a total. But again, that we have to train those people. So people who are retired, they have the special skill set, thank goodness, and we're coming back and training them with all the new information. Because I want people to know, on average, it takes about 6 months to train each of our customer service reps who do the filing of claims.
So about a week ago, you had 40 people there. Where are you now, and where do you expect to be at some point in the future?
So we initially started off with about 21. We then doubled to 40. We're now a little over 50 and counting. We are getting the help of other agencies, so hopefully that'll bump us up to like a little over 60, 70. Everything's moving so fast, but it's around that number, and we'll continue to do that. We are exploring every option on how we can better bring resources together to be able to serve everyone, all our claimants. Even if that is just Q&A answering.
So your target is to have 70, and is it fair to say that would be too squishy?
I think we will just deal with it as we can. I would consider 70 a rolling number, and if we need to increase it, we will do that. I think, having the contract now with the Amazon Web Services will allow us to explode the number of folks we have actually taking calls, because as Secretary Garcia said, a lot of these calls are things about particularly usernames and passwords, things that people haven't used for months or years even, and now they're coming back. And so all of those need to be reset. That doesn't need somebody with the training that Secretary Garcia is. So it'll free up the ones who are in labor to just deal with the more technical calls, and the folks who will be sort of, behind the scenes with the Amazon Web Services will be able to take those other non-technical calls.
Is that a new contract?
Yes, I believe that it is. I mean, I think that we have been talking with them before about some other things, but as far as I know, this is a new contract that we've signed with them.
How well is the website functioning?
I have to say, well, one, we built the capacity up in the beginning, so we have not crashed yet. There was a time span on the first weekend, and it went down for a couple hours, but given compared to other states, we have fared well so far. But I do want to note that the key, and I'm glad you asked that question, because we are functioning on a system that is old. It is not modernized. And I want you to know that when I started this job last year, once I discovered that, I said, oh my goodness, we need to do something about it. So we were beginning the modernization project. We were about to go into phase 2, and then this happened. All this is doing right now is highlighting of how old it was, and now we're in this situation.
Governor, you alluded to demands on technology. Are you putting together kind of a list of where the state is kind of short on to deal with what we're dealing with? Are you putting together a sort of a budget of what's needed and what improvements? And I guess, how would you sum up? You sort of alluded that the state's not capable to deal with a lot of this. Can you amplify on that a little bit more?
I can tell you that the situation in the Department of Labor is mirrored across a number of other agencies. We have the same different issue, but technology problems. For instance, in our foster care system and our ability to consolidate all of that information, we have a real problem with our agencies being able to share information that might be useful, from the Department of Revenue to, for instance, our benefits agencies. So we knew that. That was one of the reasons that we put Secretary Burns-Wallace over our IT entity, was to really do a deep dive and bring on professionals and the resources that we need to be able to really build out that infrastructure. That was all going on before this hit. Now this has hit, and it's just really overstraining a system that we knew was not adequate.
Governor,
I'm sorry, he's been trying to.
If we can expect to see a case increase on an exponential level, would we also be seeing a call volume or a request increase about labor questions on that same scale?
Well, that's something that, I would imagine yes, and that's why we're trying to prepare as much as possible, and how do we address that. We have, in our agency alone, we have reassessed some of the teams and divisions and repurpose them with the unemployment insurance division. And what we're doing on a daily basis is assessing and shifting according to how do we best serve, and trying to get ahead of it as much as possible.
And I think you will see, as we're, bringing employees back on, many of them have been on the 2-week administrative leave, but as we're bringing them on, as the needs increase, we'll be repurposing some of those employees to be able to assist with the Department of Labor issues.
That was April 19, right? You just said that you're going to continue
We just extended, we extended the buildings not being opened, but we will be expanding the number of services that we're providing. Most of those employees will continue to stay at home and work remotely, but we've used the last couple of weeks to gear up to be able to do that. We've had lots of folks sort of putting whatever it is you need to put into computers so that people can work remotely on the state system. So those laptops and whatnot are ready to be delivered to those employees, and starting Monday morning, you'll have a lot more employees actually working remotely. We're still not going to open the buildings, and nor are we going to open our public-facing services, at least through April 19th.
Some counties are making the decision to ask that if Kansans are traveling to maybe like Johnson County or Sedgwick County, where there's been a large outbreak, that they self-quarantine for 14 days. Does this go along with your stay-at-home order, or do you think that's something that's going to eventually become necessary to say if you're traveling even within the state to certain areas, you need to quarantine?
I don't believe that our executive order says that. I mean, the fact is, Kansans, routinely travel amongst counties. Many of them live in one county and work in another. So I think we need to maintain a consistent policy across the state.
Governor, you brought up the whole Unicast thing, and you kind of preempted the question where I'm going to end up. So you're probably anticipating it, but can you talk about how you respond? There's been a lot of kerfuffle about that
Right.
People think you're, stepping on their civil rights and civil liberties. Can you just tackle that? You obviously thought about it.
Right now, the only thing that we are thinking about really is how to protect the health and safety of Kansans. And so Unicast provides a tool that we are using. We didn't create it. We don't have any ownership in it, but it just happens to be there. All public can go on and take a look at it. And what they're going to find is not that, John Smith is, moving from here to there. It's just going to have sort of aggregated data that shows that this county is getting a C on reduction in movement, which is extraordinarily important if we are going to flatten the curve. We know that the less people are moving around, the flatter that curve will be. And not trying to be histrionic here, but we will save lives the more we flatten that curve. So that's all that this thing does. I would welcome everyone to go onto unicast.com and take a look at it, and you will see how harmless it really is, but how useful it can be to the state as we are trying to message to our Kansans, County XYZ, you need to step up your game here. You're endangering your neighbors. So that's how we're going to use that data. There's nothing else we can or would do with it.
Hey, Governor, the orders you have on essential places like daycares, is it okay, like in the case of Riley, that they tag on their specific, like temperatures need to be taken every day, you can't interact, the group of 10 can't interact with these? Is it okay that they put their specific restrictions on top of what you did?
Yeah, I don't think I'm going to interfere with something like what Riley County is doing. I mean, we're doing that in our corrections facilities. We're doing that anywhere, that we're bringing in people and they'll be in a confined space. So it sounds to me like Riley County is adopting, good public health practices, and it doesn't sound like it's terribly intrusive. So no, I probably won't be interfering with that.
Governor, I've got a text question from the Associated Press. What has the state asked for from the federal government in terms of numbers of surgical masks, respirators, gowns, etc.?
We have, actually since about mid-March or so, we have submitted, I think, over 6 orders to the feds for really hundreds of thousands of everything. Whether you're talking about surgical gowns or masks or tests, all of those things. We have gotten word that our orders have been received and they've been approved, but we haven't seen them. They have not been delivered here to Kansas. That's a problem. We have been having to go try to secure some ourselves because the shipments are just not coming in. And I would say that is not just a problem that Kansas is facing. I think 55 states and 5 territories are facing the exact same problem to different degrees. Doesn't make it any less of a hassle for us.
So I want to make sure I have this correct. Since mid-March, you submitted 6 individual orders none of which have been fulfilled?
That is correct.
What explanation do you get for that? I mean, I know it's not unique to Kansas, but what's the answer?
You know, we haven't really gotten a good answer to that question, nor has any other state. You know, I spend time every week on a phone call with all of the other governors, and they're all pulling their hair out because of that. The federal system really was not prepared for this. You know, they didn't have the stockpiles on hand to meet the demand when the demands came in, and then, quite honestly, the whatever system they have for delivery isn't working.
I don't know the details, Governor, but I've seen reports that indicate some states are faring better than others, and to some degree that's something to do with politics. Is there any evidence of that in your mind?
Well, you know, I've probably read the same things that you have, and, you know, there certainly is the appearance of that, you know, that one state might get something after somebody squawks really loudly or, you know, sends out a particular tweet. I can't overall say that it's politically based. I think, honestly, they just were not prepared, you know, that when this pandemic began in China, should have been the time that we were really looking very, very closely at what we had on hand on the federal level and prepared a system for distribution to the states, because it was clear from the get-go that this was going to be a global problem. And we just didn't take it seriously enough soon enough, and I think we're all paying the price for that now.
Governor, the suspension of the quarterly taxes, how much of that was driven by the hospitality industry? I've been hearing a lot of restaurant owners in that industry sort of complaining that they needed that. Can you talk about that?
Well, you know, they're just one of many industries that need that. You know, I can tell you that the healthcare industry, you know, just our physician offices and or our hospitals, that, you know, the elective surgery is, you know, essentially banned at this point across the state. So our hospitals, for whom that is a huge revenue source, is just not coming in. You know, doctors are not seeing patients as frequently in their office just for routine office visits. Those are way down. So hospitality industry's been impacted. So is our healthcare industry, and every other industry that we've got here has been impacted by this. I don't think, you know, other than maybe mask makers, I'm not sure there's one industry that's benefited from this. So we're seeing it overall, and I think Secretary Burghart's order was to recognize that this is a problem and that they would have a lot of difficulty remitting those taxes at this particular point. So he extended it, or he's just not going to charge any penalties on that. You know, and that was the thought process behind moving the deadline for filing your taxes from April 15th to July 15th, just knowing that this wasn't a good time to ask people to do that.
The people who have to pay estimated taxes do so quarterly, correct?
Yes.
So,
Yeah, so for the next quarter, if they file after April 15th, there will be no penalty.
Some convenience stores have decided, like Casey's here in town, to do away with the disposable cups. So people can't get their coffee in the morning. They're not getting the soft drink unless they're buying it through the coolers, of course. Is that something you find important? Is that something that you're...
I think that is a good public health strategy, yes. You know, you don't want, you know, they usually have a stack of cups, and, you know, you don't want somebody going like this and pulling one cup out to get their coffee, you know, and leaving whatever on the next cup. So, no, that's absolutely, they should be doing it that way.
Governor,
Go ahead.
okay. You mentioned before that there's some confusion from people about what's considered essential to go out and go to the stores for. And we're getting a lot of people saying these home improvement stores that are open, people are just going to like walk around. You know, have you heard anything about that? Is there anything you want to say to people who are using that essential business maybe to not do essential business?
Yeah, I have heard that. I've heard the same thing about grocery stores. You know, they're, you know, things up on Twitter or Facebook, you know, please just go in, get what you need and get out. And that's exactly what people should be doing. This should not become a recreational activity, strolling around the grocery store or the hardware store. So, yeah, I would encourage people, when we say only leave your home for essentials, food, it could be some things you might pick up at the hardware store. Go into the stores, get it, and go home. Again, you'll save lives.
Is it still too early to estimate maybe when Kansas's curve begins to flatten and maybe go down? And if so, could we expect to see an extension of some of your orders?
Yeah, we don't have really a good grasp of that yet. I mean, we can sort of look out and see what's happened elsewhere, what's happened in some other countries. And so we can do a guesstimate. And right now I think the guesstimates are somewhere towards the end of April. We'll start to peak and come down. But what we're doing is just basing it on real data that we have now and making those decisions based on that, not on some projections that may or may not come true.
Secretary, I've got a question from Auburn News. Any estimate on how long Jobless Trust Fund will be able to handle benefit payments?
So the question was regarding the trust fund and how long it will be able to handle it. So there is some good news here for Kansas. Our trust fund is solvent. We started off going into this at about $1 billion. We're not sure how long that is going to last. Compared to, we did a stress test early on, and we got, if we went at the highest rate of what we were at the recession, which we measured at about 83,000 per month, we thought we could maybe survive till February 2021. With the numbers as rapidly as they're going right now, that's clearly going to change. I want to be honest, things will probably get worse. We don't know for how long, but what we do know is that we're going to get through this together. It's going to be a partnership with people taking advantage of using our website at www.getkansasbenefits.gov and following us on all of our updates that we're going to have on social
You
media.
said 83,000, you mean
83 million.
Yeah, okay. Along those lines, there was a graphic in the paper this morning that indicated since 2016, we haven't seen in a single week's filing period any more than 5,000 initial claims, right?
Correct.
And now we've got 23,000 and 55,000. So, I mean, that's correct, right?
Correct. Those numbers are unbelievable.
How many initial claims were you seeing at the height of the 2008 recession?
In the 2008 recession, I'll refer to my time.
I don't know.
Yeah, I don't know. And we can follow up with you.
It's more than 5,
Oh.
probably not to the level we're seeing.
Absolutely, yeah, not to the level we're seeing right now. And we're seeing the trend of just from the federal numbers from 3.3 million last week to 6.6 today. If we're going to we will be seeing those trends. That's the really bad news. And we don't, but the in-between news is we don't know how that one's going to last. But the good news is we know we're going to get this together as long as we're a partnership and taking advantage of our information.
Secretary Garcia, for the people who identify as self-employed,
Yes.
maybe hairdressers or whoever, when they go online to try and apply for unemployment, that option isn't there. So, but I know you guys are saying that
Yes.
there is a workaround. Can you kind of explain what that is?
So the new federal legislation that's coming with what we call PUA, which is a Pandemic Unemployment Assistance Program that we still don't have a lot of guidance on, there will be assistance for them there as well. So right now, and now again, this is crazy news to all this, in order to qualify, you have to be denied. So right now, the best piece of advice we can tell people is go ahead and apply, and once we can get guidance, you'll already have your denial, and then we'll be able to follow up on what that is and what that looks like. Right now, we still do not have guidelines. But another piece of important information with that is if you are one of those individuals, then you would put your own name and address as your own business.
Governor, are you looking at creating separate spaces for nursing home patients with coronavirus?
Okay, so the question is, are we looking at creating separate spaces for nursing homes with patients with coronavirus? What we are doing right now is working with our large urban hospitals in our various regions, and we're doing an inventory of all beds that are within a certain distance of that regional hub, the urban hub. And so we'll be counting what beds are available in nursing homes, what beds are available in critical care or critical access hospitals or closed hospitals or any other nursing or hospital kind of bed that's available. So we're putting that inventory together right now, and then we will determine, should the need arise, and right now we're okay, but should the need arise, then they will determine which patients with what kinds of illnesses will go where. So we fully expect, we're not going to keep infected folks with non-infected people. We won't have to. We will have a system in place to make sure that that doesn't happen. In some ways, Kansas is lucky. I mean, we've all seen what's going on in New York with all these tent hospitals that are being put up, at the U.S. Open site and other places in Central Park. We're not going to have to go to that extreme. I think once we get this inventory, we'll be able to discover enough resources within actual structures that were built originally to be healthcare facilities. We'll have that. And, the good news, I hope we don't need them right now, but then, we will know where they are and be able to access those. For instance, if, let's say, this ebbs, as the weather gets warmer. No, we don't have any idea if it's going to do it, but let's say that it does, but then it spikes up again in the fall. We will know where those beds are and be able to access them really quickly. So we're putting it in place.
One more question?
When it comes to the Unicast website, and I know we're kind of going back to that, there is some concern that we've heard for people who are like farmers who have to travel long distances throughout the day, they have their phone on them, or people who live in rural areas who are driving an hour to get to the grocery store. Is there any concern that that's kind of skewing the data for some of those more rural counties? Yeah, I really haven't drilled down on the data that much to know if that's part of the issue. But even in those rural counties, what you want to see is not an elimination of any movement, but a reduction in the movement. So that's really the key is, are we seeing less movement, not no movement?
All right, thank you.
Thank you.